Globally, women make up 70% of the global health workforce, but hold only 25% of senior roles. WHO is committed to promoting gender equality everywhere, and especially in the health workforce. We're proud that we have achieved gender equality in our senior leadership team at WHO headquarters, although we know we still have to work to do in other parts of the organization. Women are also playing a vital role in the response to COVID-19, and we're proud to have many amazing women leading our response in WHO, including Maria, Sylvie, Somia, Anna Maria, Maria Angela, Mary Pierre, Adriana, Gabi, Nika, and many others. In the past 24 hours, 2,736 cases of COVID-19 were reported from 47 countries and territories. There is now a total of 98,023 reported cases of COVID-19 globally and 3,380 deaths. We are now on the verge of reaching 100,000 confirmed cases. As cases increase, we are continuing to recommend that all countries make containment their highest priority. We continue to call on countries to find, test, isolate, and care for every case and to trace every contact. Slowing down the epidemic saves lives and buys time for preparedness and for research and development. Every day we can slow the epidemic is another day hospitals can prepare themselves for cases. Every day we slow down the epidemic is another day governments can prepare their health workers to detect, test, treat, and care for patients. Every day we slow down the epidemic is another day closer to having vaccines and therapeutics, which can in turn prevent infections and save lives. As you know, last month WHO convened a meeting of more than 400 scientists to identify research priorities. Hundreds of ideas were discussed and debated. And today, we're publishing an R&D roadmap which distills those ideas into a core group of priorities in 9 key areas. These include the natural history of the virus, epidemiology, vaccines, diagnostics, therapeutics, clinical management, ethical considerations, social sciences, and more. The R&D roadmap focuses on research that can save lives now, as well as longer-term research priorities for vaccines and therapeutics. It's vital to coordinate research so that different groups around the world complement each other, so WHO can give better advice and countries can take evidence-based decisions that save lives. That's why WHO has developed a set of core protocols that outline standards of how studies should be done and to collect critical data so we can compare apples with apples and pull data from multiple studies. France and South Africa have already indicated they will use these protocols for clinical trials, and we encourage other countries to do the same. We are also developing research protocols to assess interventions for disenfranchised communities such as refugees and internally displaced persons. We're very encouraged by the level of interest around the world in accelerating research as part of the response. So far, WHO has received applications for review and approval of 40 diagnostic tests, 20 vaccines are in development, and many clinical trials of therapeutics are underway. Even as we test therapeutics, we need to ensure that supplies of those medicines are available should they prove effective. WHO has been monitoring the potential risk of a disruption to medicine supplies as a result of the COVID-19 epidemic. China, as you know, is a major producer of active pharmaceutical ingredients and the intermediate products that are used to produce medicines in other countries. WHO has focused on the most essential medicines that are critical for primary health care and emergencies, including antibiotics, painkillers, and treatments for diabetes, hypertension, HIV, tuberculosis, and malaria. WHO is working closely with industry associations, regulators, and other partners to monitor this risk. And so far, we have not identified any imminent specific shortages. Many manufacturers either have alternative sources of ingredients or had stocks to draw on. Manufacturing has now resumed in most places in China, although some challenges remain. Separately, WHO has developed a list of more than 20 essential medical devices that countries need to manage patients, including ventilators and oxygen supply systems. Access to medical oxygen could be the difference between life and death for some patients, but there is already a shortage in many countries, which could be exacerbated by this epidemic. WHO has an existing working group with the Gates Foundation, the Clinton Health Access Initiative, and PATH. And we're building on that partnership to increase access to oxygen. We encourage every country to review WHO's disease commodity package for COVID-19 to ensure it has the supplies it needs, including protective equipment and medical devices. All of this requires the involvement of the private sector to ensure countries can access life-saving products. You have heard me talk about the market failure for personal protective equipment. You heard me talk about the need for a whole of government approach. And you have heard me talk about what individuals can do to protect themselves and others. We look forward to businesses to step up and play their part. We need you. WHO is working with the World Economic Forum to engage companies around the world. And earlier this week, I spoke to more than 200 CEOs about how they can protect their staff and customers, ensure business continuity, and contribute to the response. As I keep saying, we are all in this together, and we all have a role to play. Facts, not fear. Reasons, not rumors. Solidarity, not stigma. I thank you.
Thank you very much, Dr. Tedros, for these opening remarks. We will start with the questions here from the room. We'll have start with the chant, then here, and then we'll have a question here. Yes, we don't use the microphone. If you can just switch it off and talk a little bit louder.
From Xinhua News Agency. The epicenter of the epidemic is in China. Because recently, Fox News Post demanded a formal apology from Chinese for the outbreak of coronavirus. What's the comment from WHO forward the remark? Thank you.
I'm not aware of the comment, but I think we've said numerous times in previous conferences that diseases can emerge anywhere on the planet and have proven to do so. Ebola emerges very often in Africa. The last pandemic emerged in North America of H1N1, and coronavirus has, in this case, emerged in China. So I think the issue now is, as the DG has just said, can we avoid blame culture, and can we move on to do the things we need to do to save lives?
Thank you very much. Maria, please, and then we'll go to Dr.
Official reports in Iran shows a huge spike in identified cases of COVID-19. Spokesperson of Health Ministry today said that they identified more than 1,200 for past 24 hours. What are the actual categories or assess the way outbreak is managed in Iran, especially when we have a question?
It's very important in epidemic response to understand your problem, because without understanding your problem, it's very difficult to fix it. So we've seen this. China's numbers went up very, very quickly because they started to look for cases. The same happened in Korea, when Korea started to do active surveillance, and then you can turn a corner. So I think we need to look at these data in terms of, yes, natural epidemiology, but also I think because the Iranian system is switching on, we're seeing a much more all-of-government approach, as the DG called for yesterday. There's a national action plan now. There's 100,000 workers committed to this plan. And we are going to see any country in the face of an epidemic, when it looks for cases, will find them. And if we call that a bad thing, it is. It's a sad thing for the people who have the disease. But it's much better that we understand the extent of the problem. So we commend the move towards more aggressive, targeted surveillance, and we hope that that will lead to the kind of control measures that can help push this virus back.
Much. One question here, then we will move online. One question, please.
Hi, my name is Ken. I'm from the Japanese newspaper Yomiuri. I'd like to ask about Japan and Korea. It's travel restriction. And so both nations have been implementing travel policies against each other. And in Japan, part of the Korean measures are taken to be retaliatory. So can you tell us about to what extent these travel restrictions are meaningful? And do you have any concerns on countries countering and escalating against each other?
I think we've been pretty clear on the issue of travel restrictions for a very long time. They should be very carefully considered. They should be public health evidence driven. They should be of short duration, and they should never be carried out in the absence of a comprehensive set of measures to contain or control the disease. There is a long history, unfortunately, of countries sometimes with tit-for-tat travel restrictions, and that has happened in the past. Since the advent of the IHR, in fact, we've seen a huge improvement in that and in transparency between countries, because we challenge countries who put in place travel restrictions, and we challenge them to provide the public health evidence. I think Japan and Korea are both doing a fine job in the face of this epidemic. They've both scaled up their public health operations. They're saving lives, and I think we should focus on that and not necessarily on political spats over travel restrictions. It's very, very important that people understand that these types of restrictions are not helping, and in that sense, to overemphasize them is to hurt the response. But we do commend both governments for making significant progress in fighting this disease.
If I could just say something to the contrary to that, in the sense that what we are seeing and what the stories need to be focusing in is how countries are helping each other. And we see a lot of examples of this. The DG mentioned this research meeting that took place on the 11th and 12th. We've been talking since the beginning of scientists communicating with each other, clinicians talking to each other on the phone, sharing experiences. When the world didn't have experience with COVID-19, we had MERS scientists teaching each other about what they did to help patients with MERS, patients with SARS. And I think there's a lot of very positive stories here where countries are helping each other. We have a Chinese delegation in Iran right now. We have people participating and sharing, and I think that there's a lot of lessons to be learned in that. This is not the first outbreak where this has happened before. WHO brings together scientists all over the world, public health professionals, women on the front lines, and I think those are stories that also need to make the headlines as well.
I would like to add to that. In a globalized world, the only option is to stand together. And, all countries should really make sure that we stand together. And in addition to that, as you know, COVID-19 is a common enemy. And the only way we can beat this virus is when we stand together. And that has been the message from WHO all along. And it is, and it will be. So we call on all countries to stand in unison, because it's the united force that can help us to beat this virus as soon as possible.
Thank you very much. We will now go to some of the journalists who are online. And I'll remind everyone, it's a *9 if you are dialing in, and clicking raise hand if you are on. We'll start with Romania. We have Adrian. Adrian, can you hear us?
Yeah, hello. I'm from ProTV Romania. So speaking about Europe, from your estimation, do you think that during the summer the spread of COVID-19 will decrease? And another thing I want to know, if World Health Organization experts send to all the countries some procedure about how to test a person, because we have some problems here in Romania. And what are the criteria you set when you consider a person suspected of being infected with coronavirus? Are these standard procedures?
We lost you in the middle. Can you please repeat the question? Sorry.
Okay, so speaking about Europe, from your estimation, do you think that during the summer the spread of COVID-19 will decrease? And another thing I want to know, if World Health Organization experts send to all the countries some procedures how to test a person, and what are the criteria you set when you consider a person suspected of being infected with coronavirus?
I think Maria can take the question on seasonality. I think our regional director, we've had multiple meetings with the European countries across our whole region, plus at the European Union level with the European Centre for Disease Control. Our regional director has been again in meetings today with European health ministers, coordinating actions between countries. We do not know yet what the activity or the behavior of this virus will be in different climatic conditions. We have to assume that the virus will continue to have the capacity to spread, and it's a false hope to say, yes, it will just disappear in the summertime like influenza virus. We hope it does. That would be a godsend, but we can't make that assumption. And there is no evidence right now to suggest that that will happen. So we need to fight the virus now, not live in hope that the virus may disappear on its own. On the issue of definitions, there are very specific case definitions that have been released and updated on a regular basis by WHO. Maria may want to go into the detail on the criteria.
So we do publish surveillance guidance on our website, as we do with all of our technical guidance, and we are constantly looking at the evolving situation to update those. Our case definitions are focusing on people of interest, who should be tested, and it's a combination of factors. It has to do with where a person is, where they are living, where they have traveled. It has to do with if they have symptoms or not, and what level of symptoms that they have. So our latest guidance is on the WHO website. And there's a very detailed description of who should be tested.
And again, to be clear, when there's a high index of suspicion from a clinician that the clinical syndrome is consistent, the clinician is in a position to request a test. The test is not restrictive. The criteria are not restrictive. What we have to be careful with is that if every single person with a sniffle is to be tested, then we will run out of the capacity to test. So there are major criteria, but that final decision is very much left in the hand of the attending physician based on their instinctive or clinical judgment. And if there are symptoms highly consistent with the COVID infection, that physician may request that test, or that is at least WHO's advice.
Yes, and context. So that's the other one, is not just in that index of suspicion, but also if you have a confirmed case and you're looking at the context of those cases, they need to be tested as well.
Thank you very much. Next question came through message, because there was Steve from Uganda, from MBS TV in Uganda, is asking what measures have been put in place to contain the virus in Uganda. He says Uganda being a poor country.
I think Uganda has proven its capacities over the last year and a half. And Uganda has invested heavily in its preparedness for Ebola, and imported, unfortunately, Ebola twice from Congo, and contained that disease without any further cases. Uganda has a lot of capacity and history in dealing with severe emerging disease that spread from person to person and require the isolation of cases and the follow-up of contacts. And as the Director General has been saying for years now, this is about preparedness. You prepare for one disease, you prepare for all diseases. Preparing for Ebola gives you capacities against COVID. Preparing for flu gives you capacities against other diseases. And what we hope is that these investments that are being made by countries like Uganda, and that we want to make under the new Emergency Preparedness Division here at WHO, it's really important that we focus on that. Other countries, Uganda has a strong system, but we are concerned that there are countries who have much weaker surveillance, much weaker health systems, and we need to continue to support all countries in getting ready. DG may have a comment on this.
Thank you. Thank you very much. So this was answer to question from Steve from Uganda, NBS TV. If Chris is fine, we can go to one more question, or two more questions from online. Elaine Fletcher from Health Policy Watch. Banjo Kaur from Down to Earth, India. Banjo, can you hear us?
Yes, I can hear you. Can you hear me?
Go ahead.
My question is to Dr. Maria. Maria, we had only 5 cases till 3 days ago, but now we are, up to 31 cases. But the testing criteria in our country is limited to suspected cases or to the ones who have been in contact with the confirmed cases. Do you recommend that, as Dr. Mike was saying, that we should now expand our criteria, and a clinician, if he finds that it is necessary, be allowed to recommend a test, an investigation test?
Thank you for the question. So we put out recommendations of what we feel is most appropriate for testing. And it is important that countries look at these and they make an assessment of what is best for their country. Our guidance is out there to be aggressive at finding all cases among people of suspicion and ensuring that the contacts of those cases are also tested so that we can prevent onward transmission. Decisions need to be made based on capacity, based on many different factors, but it really is important, especially early on. As you said, you have some cases in your country. It's very important that there's an aggressive approach in the beginning, that you look for all of those cases, because as case numbers increase, systems become overwhelmed. And so as much as can be done in the early stages of this, the better chance you have to delay and to reduce and suppress transmission.
Thank you very much. We will now go to Elaine Fletcher from Health Policy Watch. Elaine, please go ahead, and sorry.
No, thank you. Hi, thanks for taking my question. The World Bank announced recently that we'll put its spring meeting on a virtual format, and that move was applauded in many quarters as something that would also save carbon emissions and travel costs, which are significant for global organizations. And many private companies, meanwhile, have also begun to encourage teleworking as a preemptive move to reduce infection risks. What's your message on these topics? And is WHO making contingency plans for a virtual World Health Assembly?
leave the DG to comment on the World Health Assembly. I think we advise a risk management approach to all of these different gatherings and meetings, and I think we are entering a new era on this planet in terms of our movement and how we engage and how we interact with each other. And it's wonderful to see that we have alternatives now to necessarily having to meet face to face all the time. And if there is a benefit to the planet, then that is great. But we would obviously rather not have COVID-19 and the fear and the disruption that it's causing. But life has to go on. Our economies, our societies, our communities have to continue to work, to live, to educate. But I think we also need to innovate. And it's wonderful to see the innovation in education, the innovations in communications, the innovations in our capacity to continue doing the things we do, but maybe using alternative ways of achieving the same ends. And if there are benefits to our planet for that and to our society in general, that's great. But I think we'd like to get rid of COVID-19 too. Huh?
Yeah, maybe to add to that, I know we will have this COVID-19 behind us, and virtual meetings should actually be considered, not because of COVID now, but when there is no COVID. We have to challenge, all our meetings, whether we really need to meet in person. So that's our advice. But in the middle of the COVID-19 now, as Mike said, we have to do the risk assessment, and make our decisions based on that. But the virtual meetings, teleworking should actually be an issue, even when we don't have COVID around. As you said, one added advantage is minimizing the carbon footprint, but there will be other advantages too.
Go back to
Of course,